You feeling okay? Let's get you to the doctor. What's wrong? I just always get so nervous going to the doctor. He's coming. We have to get out of here. Hello, doctor.
Oh, I'm not a doctor. I'm a PA.
How do I explain that one? I mean, come on now, PAs aren't that scary. So today, let's talk about PAs. What the heck is a PA? So I'm a PA. I've been a PA for the last 5 years, and I want to talk to you about some of the most common misconceptions I get about what I do and my profession in general. A recent survey showed that about 75% of people could not tell you what a physician assistant does. I get this all the time. When are you going to go back to med school? When are you going to become a doctor? People are often so confused when I tell them, I'm not. I'm finished with school, and I have no plans to go back to medical school or become a doctor. So let's first start by stratifying the different medical titles. A PA is an advanced practice provider, also known as a mid-level provider. At the top, you have your doctors. Now, these are your medical doctors, your MDs, and your doctors of osteopathy, or your DOs. So below that, you have your mid-level providers. These are your PAs, your nurse practitioners, your nurse anesthetists, other mid-level categories who, although they can practice medicine, there's some type of restriction on their license. Such as PAs, we do have a supervising physician, so we don't always make the final call on things, but we do the majority of our clinic and treating patients by ourselves. And below the mid-levels, you have the rest of the medical field. This includes your nurses, your respiratory therapists, your physical therapists. The big difference between this group and the mid-levels or even the doctors is that the nurses, the respiratory therapists, the physical therapists, those in the group that are not in the high tier or the mid-level tier, they typically do not make medical decisions on their own. For example, if a patient is in the hospital and the nurse taking care of that patient notices that their blood pressure is dropping, typically the nurse themselves does not make the decision to order medicine. What they do is they call either a mid-level provider or the doctor, the attending, whoever's in charge of that patient at that time, to report the information and request an order to treat the patient. Now, this is just in relation to their licenses. This has no correlation at all with the actual professions themselves. I work with a large number of nurses who are great at what they do, and I highly respect them, and I value their input. But they typically cannot order medicines or treat patients by themselves, although they are a vital part of the healthcare team. So a large part of the confusion over physician assistants is actually the title itself. When people hear the term physician assistant, they often think we are either a medical assistant or just an office assistant and not advanced practice providers. There's actually been a lot of discussion in our own field about changing our title in the near future. So what do PAs actually do? Well, there's a lot. So PAs can
take medical histories, perform physical exams, order and interpret tests, diagnose and treat illnesses, prescribe medication, counsel on preventative care, round in the hospital and nursing homes, perform procedures, assist in surgery, and do clinical research.
So as you can see, there's a lot that PAs can do, but I want to highlight some of the main things we do on a daily basis. So after taking the history, one of the most important things that PAs can do is we can actually perform the physical exam. The exams that the PA is going to do varies greatly depending on what specialty they're in. I personally, working in orthopedics, have done everything from concussion testing to neurovascular abnormalities. There's a whole lot of exams that we've been trained to do and can do very well. After we perform the exam, we can also order and interpret tests. Now this includes everything from your routine blood work to MRIs, X-rays, CT scans. There's all sorts of things that PAs can order, but not only can we order the tests, but we can also interpret them. After we get the results from the test back, we can then make the official diagnosis for patients that goes inside your medical record. Now, diagnosing and treating are two of the things that make PAs autonomous and that we can see our own patients and have our own schedule. So this allows us to actually make official diagnoses in which we can treat the patient and that will provide ongoing and continuing care for the patient. And after the diagnosis, the next thing we do is we actually treat the patient. So in a typical day, I see the patient from beginning to end. That's from the check-in, they come back, they see me, we talk, they get the history, we do the physical exam, I order any tests I think are needed, I make an official diagnosis, and then I treat the patient. Now, this can be with a number of modalities. This can be prescribing medication. We can do that. This can also be procedures. I do a ton of joint injections, aspirations, suturing, all sorts of musculoskeletal injuries and treatments in that way. We can also write prescriptions for durable medical equipment. Now, this is your crutches, your wheelchairs, and other devices. And I can also refer out to other providers or other specialties. Now, one quick distinction, as PAs, we can perform procedures in office and in the hospital too, but we typically do not perform surgeries by ourselves. This is typically reserved for those surgeons who've spent years and years in residencies and fellowships learning the technical aspects of surgery. Now, we do first assist in surgery, so we are present in the surgeries and we do a lot of closure and just assisting in the surgery itself. We do not perform surgeries ourselves. So I hope you understand a little bit better what a PA is and what we actually do in our clinic. We're not just assistants. We are actually advanced practice providers that provide high quality care to a large number of patients.